Imagine a medical condition that causes widespread pain, affects 2 to 4% of the population, and is really hard to diagnose. Any guesses? Well, I'm talking about fibromyalgia. This is a topic that many of you have been asking me about. You saw my segment on the Dr. Oz show on fibromyalgia, and you have questions. So today, we're going to give you answers. Before we start, please make sure you subscribe to my channel. I got lots more videos like this one. Also, make sure that you hit the little gold bell to make sure that you keep getting updates. Many of you have heard the word fibromyalgia, or maybe you have fibromyalgia. In either case, we're going to talk about what it is and what it's not. So let's start with what it's not. Fibro or fibromyalgia is not an autoimmune condition. It's also not an inflammatory condition. And it's also not all in your head. If you have fibro or think that you might have been made to feel like it's all in your head, or that it's a fake condition, or that you're crazy, for lack of a better term. But you're not, and fibro is very real. Not only is it real, it affects a lot of people, believe it or not. Fibromyalgia affects 2 to 4% of the population. You're not alone. In addition, more women are affected by fibro than men, and it tends to affect people kind of in their 30s, 40s, around that age group. Fibro is also notoriously difficult to diagnose, and this is why so many people say that they've had to visit many doctors to actually get an accurate and appropriate diagnosis. Some of the reasons for this are, first of all, there's no one test that proves or shows fibromyalgia. There's not a blood test or an image or a lab, an x-ray, an MRI, or anything that we can do to order that says, oh, you have fibro. So that's the first thing. The other thing is that the symptoms of fibromyalgia often overlap the symptoms of other conditions like rheumatoid arthritis or lupus or arthritis, etc. So it can be very tricky. And I would say the third thing is that oftentimes we doctors simply don't consider it as a possibility. How would you even know if you have fibro? How would your doctor go about trying to figure out if this fits you? Well, the first thing is that fibromyalgia, the first characteristic of it is chronic, widespread pain all over the body. The second thing is that this pain needs to have lasted for at least 3 months or longer. And finally, in terms of the pain aspect, no other condition can explain the pain. So in other words, your pain is not explained by osteoarthritis or lupus or some other underlying condition. But fibromyalgia is not just about pain. It's about additional symptoms as well. So the fourth category patients with fibro have is they have one or all of these 3 symptoms. One is cognitive impairment. That means you feel foggy. Many people call it fibro fog. Maybe you have memory deficits, or you just don't feel right in terms of your thinking. The other thing is fatigue. Many people with fibromyalgia just feel tired and wiped out. And the third thing is waking up feeling unrefreshed. That means you got a good night's sleep, but you wake up in the morning feeling like you didn't sleep at all. Finally, the last symptoms that people have with fibromyalgia are what we call somatic symptoms. And that's a big, long list of symptoms that can range from anything such as depression and anxiety to irritable bowel syndrome to acid reflux, GERD, nausea, vomiting, abdominal pain. There's many symptoms that fall into that somatic symptom category. But to be diagnosed with fibromyalgia, that is a part of the diagnosis, and people with fibro also have these somatic symptoms. If you think this might be you or someone you know, what should you do first? Well, the first thing is to see your doctor. Whether it's your family physician or your internist, etc., see your doctor to talk about your symptoms and potentially your concern about fibromyalgia. Remember that in addition to your family doctor or your internist, you can also see a rheumatologist or other specialist that deals with fibromyalgia. The most important thing, though, is to get a proper diagnosis and to understand it's not all in your head. Thank you guys so much for joining me as always. Please make sure that you subscribe to my channel and you click the little bell to make sure that you get updates, and make sure that you stay tuned because there are lots more fibromyalgia videos coming soon.